Common foods are overloading your kidneys. Most people discover this only when the damage is already done. That sentence sounds dramatic, but science is finding a truth behind it. Kidney damage often seems to appear suddenly, without warning, because the damage builds quietly for years. Tens of thousands of people are being diagnosed with chronic kidney disease every week around the world, and for many of them the first clue is an abnormal lab that shows the kidneys are already struggling. In this video, you'll learn how everyday foods and habits can quietly overload your kidneys, how to recognize the early signs, and what practical steps you can take now to protect, and, in many cases, slow or partly reverse, early kidney damage. If you want to know which labs to ask your doctor about, download the free kidney lab checklist in the description below and keep watching. To make sense of why this problem can feel so sudden, we need a quick primer on how kidney disease is defined. Clinicians use a number called eGFR, estimated glomerular filtration rate, to describe how well your kidneys filter blood. The stages of chronic kidney disease are commonly described like this. Stage 1 means normal or high eGFR, 90 mWs, min 11, 73 mmt or higher, but evidence of kidney damage. Stage 2 is mild reduction, eGFR 60, 89. Stage 3 is moderate, split into 3A, 45 to 59, and 3B, 30, 44. Stage 4 is severe reduction, 15 to 29, and Stage 5 is kidney failure, less than 15, or needing dialysis. Another key test is urine albumin. Even small increases in albumin in the urine can be an early sign of damage. The crucial point: in stages 1 to 3, many people have few or no symptoms, so the condition can progress unnoticed until it crosses a threshold where labs or symptoms finally alert a clinician. That explains why kidney damage can appear to happen suddenly. It didn't start overnight. It started quietly and accumulated. Most chronic kidney disease you see in primary care today isn't caused by rare inherited disorders. The largest share is driven by 4 root, often modifiable problems: metabolic dysfunction centered on insulin resistance, the effects of processed and common foods on electrolytes and inflammation, chronic underhydration, and exposure to nephrotoxic medications or toxins. We'll walk through each of these, how they harm the kidney, the kinds of foods and behaviors to watch for, and what you can do about them. Start with insulin resistance and high blood sugar. When cells stop responding properly to insulin, the body compensates by making more insulin, and blood sugar swings become larger. High insulin and glucose over time create a pro-inflammatory state and raise blood pressure. In the kidneys, this shows up as a period of hyperfiltration. The tiny filters called glomeruli work harder and faster for years, which initially keeps creatinine low but slowly damages those filters, leading to scarring. Over time, that scarring reduces the number of functioning filters and causes declines in eGFR and increases in albumin in the urine. Foods that most strongly drive this process are those that trigger rapid, repeated blood sugar spikes: sugary beverages, desserts, many refined grain foods, and the high glycemic combinations found in common fast food meals. The pattern to watch for is not just a single high-sugar day, but a chronic diet that keeps insulin and blood sugar elevated. Next, processed foods and electrolyte imbalance. Salt is the obvious culprit most people think of, but the story is more nuanced. Processed foods deliver very high amounts of sodium while being low in potassium and magnesium, minerals that normally balance sodium's effects. The ratio of sodium to potassium in your diet matters for blood pressure and for how the kidneys manage sodium. Many processed meats, canned foods, instant soups, packaged snacks, and fast food items also contain phosphate additives, preservatives, and other compounds that increase the kidney's workload. Phosphate preservatives, for example, are absorbed more readily than natural dietary phosphate and can raise the circulating phosphate burden, prompting hormonal responses and strain on renal handling. Diet sodas and some packaged products include phosphate additives too. Low dietary potassium, common when vegetables and fruits are swapped for packaged alternatives, worsens sodium retention and blood pressure, and deprives the kidneys of a protective electrolyte environment. This imbalance, high sodium, low potassium and magnesium, plus additives, is a hidden way common foods overload the kidneys. Chronic dehydration is the third driver. Kidneys need adequate perfusion and a relatively balanced fluid electrolyte milieu to clear waste and maintain internal stability. When fluid intake is chronically too low, blood becomes more concentrated. Toxins and waste products are relatively higher per unit volume, and small blood vessels supplying the kidneys can constrict. That raises the risk of kidney stones and acute on chronic injuries. Dehydration also intensifies the effects of other stressors. A high-sodium meal is harsher on a poorly hydrated person than on someone well-hydrated with balanced electrolytes. Many people underestimate how modern habits, caffeine, alcohol, long workdays, and inadequate awareness of thirst signals, can push them into a mild but chronic dehydration state. Finally, certain commonly used medications and exposures can damage kidneys directly or indirectly. Over-the-counter NSAIDs, like ibuprofen, reduce prostaglandin production and can lower renal blood flow in susceptible individuals, increasing risk of acute kidney injury and worsening chronic disease. Long-term proton pump inhibitor use has been associated with increased risk of kidney problems in observational studies. Some antibiotics and older agents like aminoglycosides can be nephrotoxic, and contrast dyes used in imaging carry risks, particularly in already vulnerable kidneys. Even herbal supplements and unregulated natural products sometimes contain contaminants or high concentrations of minerals that can be harmful. The important principle: many helpful medications are safe when used appropriately, but misuse, overuse, or combinations with other stressors, dehydration, high-sodium diet, uncontrolled blood pressure, can tip the balance toward injury. Always discuss medication concerns with your clinician before making changes. Let's take a focused look at the foods themselves, the ones you probably see in your kitchen or reach for at lunchtime, and how each category can overload the kidneys. Ultra-processed snack foods and chips are high in refined starches, unhealthy fats, and a heavy sodium load. That sodium raises blood pressure and makes the kidneys filter and reabsorb more, increasing oxidative stress in kidney cells. Packaged baked goods and snacks often lack potassium and magnesium, so the electrolyte balance tilts in the wrong direction. Fast food meals typically combine high sodium, refined carbs, trans and saturated fats, and sometimes phosphate-containing additives. They drive insulin spikes, contribute to weight gain and hypertension, and deliver a triple hit: metabolic stress, electrolyte imbalance, and inflammatory load. Processed meats, hot dogs, deli meats, sausages, are not only high in sodium, but also frequently contain phosphate preservatives. Dietary phosphate from additives is more bioavailable than phosphate from whole foods. That raises circulating phosphate and forces the kidneys to work harder to excrete it. Over time, that can be one more factor nudging the kidneys toward dysfunction. Sugary beverages and sweetened foods create repeated glucose and insulin surges. Each surge is a small hit to the metabolic system. Over years, that pattern contributes to insulin resistance, inflammation, and vascular damage, including in the microvessels of the kidney. Canned and packaged soups and sauces are deceptive. Even low-sodium varieties can contain enough salt and additives to matter if eaten frequently. Labels may underrepresent hidden sources of sodium and phosphate, and the cumulative effect of daily processed sauces can be significant. Diet sodas and some artificially sweetened drinks add another layer. Some contain phosphate additives, and while they may have zero sugar, they can still influence mineral handling and health in ways that are not entirely benign. What should you be watching for in your own body? Early signs of kidney stress are often subtle: persistent fatigue that doesn't respond to sleep, mild swelling of the ankles or around the eyes, foamy urine or a shift in urination patterns, going more or less often than usual, and recurrent cramps or muscle weakness that can reflect electrolyte imbalances. High blood pressure that is hard to control is also a common clue. So is evidence of metabolic syndrome, elevated fasting glucose, high triglycerides, central obesity, which often goes hand in hand with kidney risk. None of these signs is definitive on its own, but together they should prompt lab checks and a serious conversation with your clinician. If you're at risk, for example, you have diabetes, high blood pressure, a family history of kidney disease, or long-standing metabolic issues, the labs worth understanding are eGFR, serum creatinine, and urine albumin to creatinine ratio, ACR. Ask your clinician for those tests. The free checklist in the description lists them and gives suggested intervals. One nuance worth knowing: eGFR is an estimate based on creatinine and other factors and can be influenced by muscle mass. An athlete with high muscle mass may have a different baseline than someone very lean. That's why trends over time matter more than a single number. Now for the practical part: how to reduce the daily overload on your kidneys. These are strategies rooted in the mechanisms we reviewed: lower insulin spikes, rebalance electrolytes, hydrate intelligently, and reduce exposure to nephrotoxic agents, but framed as doable changes you can start right away. Dietary approach: prioritize whole foods, and reduce refined carbohydrates. A practical rule of thumb is to make vegetables, whole fruits, legumes, whole grains, and minimally processed proteins the base of most meals. Swap common problem items for alternatives. Instead of chips, have a handful of nuts or vegetable sticks with hummus. Swap sugary sodas for sparkling water with a squeeze of citrus. Replace processed deli meats with grilled or roasted lean proteins prepared at home. Focus on increasing dietary potassium through foods, bananas, avocados, potatoes, with skin, leafy greens like spinach and Swiss chard, beans and lentils, oranges and tomatoes. These foods help balance sodium and support blood pressure and kidney health. For magnesium, include nuts, especially almonds and cashews, seeds, pumpkin chia, whole grains, and dark leafy greens. Be mindful of phosphate additives. Read labels for terms like phosphate, sodium phosphate, phosphoric acid, or calcium phosphate. When you see those, consider swapping to a less processed alternative. Eating fewer processed meats and choosing fresh or frozen fish, poultry, or plant proteins reduces this hidden phosphate load. Hydration strategy. Aim for steady, balanced fluid intake rather than periodic large gulps. Hydration needs vary by body size, activity, climate, and medical conditions. Don't rely on a single, one-size-fits-all number. A practical sign of adequate hydration for many people is light-colored urine and not feeling thirsty most of the day. In situations of prolonged activity, sweating, or if you're on a low-sodium or high-potassium plan, a balanced electrolyte solution or a modest electrolyte mix can be helpful. Look for formulations that provide sodium, potassium, and magnesium in reasonable balance, or focus on whole food electrolyte sources like bananas, potatoes, and leafy greens. If you have established kidney disease or are on medications that affect potassium, discuss electrolyte choices with your clinician before taking supplements. Supplements and minerals. Food. First is the safe starting principle. Magnesium and potassium from dietary sources are preferable. Supplements may be appropriate in certain situations, but doses and forms matter and should be coordinated with your clinician, especially because impaired kidneys can change how your body handles potassium. Avoid over-the-counter high-dose potassium supplements without medical oversight. Medications and safer alternatives. Frequent or long-term use of NSAIDs is a common risk factor. For many aches and pains, alternatives include topical NSAIDs, physical therapy, heat or cold therapy, strength-building exercise, and acetaminophen as a short-term option. If you're dependent on daily NSAIDs, speak with your clinician about safer long-term strategies. For acid reflux, discuss step-down options for proton pump inhibitors and whether H2 blockers or lifestyle measures may be suitable alternatives. If you need imaging or antibiotics, let the ordering clinician know about any existing kidney concerns so they can choose agents and dosing that minimize risk. Stress, sleep, and blood pressure management matter too. Chronic stress raises blood pressure and promotes insulin resistance. Simple practices that often help include prioritized sleep, 10-20 minutes of daily movement, structured breathing or mindfulness exercises to lower sympathetic tone, and consistent timing of meals to stabilize blood sugar. Small sustained changes here have outsized benefits for kidney protection because they reduce the underlying drivers, high blood pressure and metabolic stress. Monitoring and medical partnership. Ask your clinician for baseline labs if you have risk factors. Beyond eGFR and urine ACR, consider fasting glucose or HbA1c to assess blood sugar control and ambulatory or home blood pressure monitoring if office readings are inconsistent. For people with early-stage CKD or with risk factors, repeating these labs every 3 to 12 months is common depending on severity. Your clinician will advise frequency. If you're unsure what to request, use the checklist in the description to guide that conversation. A composite example can make this real. Imagine a 52-year-old office worker with long-standing borderline high blood pressure, a desk job, occasional fast food lunches, and a habit of taking ibuprofen 3 times a week for headaches. She notices she's more tired, her ankles are slightly puffy at the end of the day, and her home blood pressure is often a bit high. Her clinician orders eGFR and urine ACR. The tests show a modest reduction in eGFR into the stage 3A range and a urine ACR that is above normal. Rather than immediate invasive procedures, the team focuses on reversing modifiable factors, a shift to whole food lunches, cutting down sugary drinks, daily hydration, and mindful sodium reduction, switching from regular NSAID use to alternative pain strategies discussed with her clinician, and a short program to improve blood sugar control through diet and daily walks. Over 6 months, her blood pressure comes down with lifestyle changes, her urine albumin drops, and her eGFR stabilizes. This is a composite example, not guaranteed for everyone, but it illustrates how early-stage changes often produce meaningful improvements when done consistently and under medical guidance. There are also limits and urgent scenarios to emphasize. If you experience rapid, severe swelling, sudden and marked decrease in urine output, very high blood pressure that feels like a medical emergency, or sudden severe flank pain, seek urgent medical care. Those are signs that require immediate evaluation. Likewise, if you have known advanced CKD or are on medications that affect electrolytes, do not change supplement or medication regimens without clinician approval. Interpreting labs requires context. eGFR is an estimate and can be affected by age, sex, race adjustments in older formulas, and muscle mass. Creatinine-based measures can understate kidney issues in people with low muscle mass and overstate it in people with high muscle mass. That's why trends over time and the urine albumin to creatinine ratio are critical pieces of the puzzle. If a clinician minimizes your concern because your eGFR is within the normal range, but you have other risk factors or persistent albuminuria, ask for a more detailed discussion or referral to a nephrology specialist for a second opinion. To make this practical for a week-to-week routine, here are realistic meal and habit swaps you can try over 7 days without strict calorie counting. Breakfast centered on whole grains, legumes or eggs with vegetables. Lunches of salads or bowls with beans or grilled protein, avocado and a whole grain. Snacks like a piece of fruit with a small handful of nuts or Greek yogurt and berries. Dinners focused on grilled fish or legumes, steamed greens, and a baked sweet potato rather than fries. Replace sugary beverages with water, sparkling water with citrus, or unsweetened iced tea. Choose fresh or frozen proteins over processed meats, and cook at home when possible to control sodium and additives. These swaps lower sodium, boost potassium and magnesium, and reduce refined carbs. All changes that lessen the daily overload on kidneys. If you decide to use an electrolyte supplement occasionally, for example after intense sweating or during travel, choose one described as a balanced electrolyte mix that contains sodium, potassium, and magnesium in moderation. Whole food alternatives are often even better. A banana and a small handful of nuts, or a baked potato with a little olive oil and herbs, provide a natural mix of electrolytes without additives. If you have known kidney impairment or are on medications that affect potassium, check with your clinician before adding supplements. Finally, a few practical points about communicating with your clinician. Use the lab checklist from the description to ask for eGFR, serum creatinine, urine ACR, and, if relevant, fasting glucose or HbA1c. Bring a list of your regular over-the-counter medications and supplements. If you rely on NSAIDs regularly, ask about alternatives and about pain management strategies that carry lower kidney risk. If your clinician suggests that a slightly low eGFR is expected for your age, ask what the trend has been over the past several years. A stable number is different from a downward trajectory. We started this video with a strong claim. Common foods are overloading your kidneys. That claim isn't meant to scare you. It's meant to motivate careful attention. Research and clinical experience suggest that diet and lifestyle are major contributors to kidney stress, particularly when combined with dehydration, medication exposures, and metabolic dysfunction. The good news is that early stages are often modifiable. Small, consistent changes, less processed food, more whole plant foods, smarter hydration, safer use of pain medications, and better blood sugar and blood pressure control add up to real protection for your kidneys over months and years. If you found this useful, subscribe and click the link in the description for sources, a printable guide, and the free kidney lab checklist to take to your next appointment. Remember, this video is educational and not a substitute for medical advice. If you have symptoms, abnormal labs, or concerns about medications or supplements, consult your clinician. Early attention often makes the biggest difference. Your kidneys quietly do the work every day. A few informed choices can reduce their burden and preserve their function for years to come.